I am your host, U.S. Army retired colonel and veteran combat medic, Dr. Damon T. Arnold. Today we have a really special guest. Fred Schulte is a senior correspondent for KFF Health News, and Fred's KFF Health News article, Feds Killed Plan to Curb Medicare Advantage Overbilling After Industry Opposition, is a must read. Everyone should be paying attention to what he's saying. This is a critical article regarding Medicare and what has happened because of the feds killing this. So I'm going to let Fred Schulte explain and set the groundwork for it, and then we can have a discussion about some of the implications of what he's found. Hi, Fred. How are you doing?
Hi, fine. How you doing?
Good, good,
Good. Good to hear.
good. So maybe you can give us an overview, a little bit of an idea of the article, and then also people need to be reading this. How can they reach out to your article and make sure they connect with that source?
Well, the article is it's run in a number of different places, but you can find it on our website. That's KFF healthnews.org. And what this article was about, it was about the Medicare Advantage program. There are two ways you can get on Medicare. You can get the standard traditional Medicare, and then you can get Medicare Advantage. Now, the
Mhm,
traditional Medicare plan, it doesn't cover a lot of stuff. So a lot of
mhm.
people have to then get a supplemental insurance policy to
Yes.
cover the holes that are in the original Medicare. So it's become much more popular in last few years, and now is over half the people on Medicare have chosen to enroll in these insurance plans that are run mainly by big companies, private insurers, and they provide all of your health care services, and it can it can be a lot less money out of pocket. The trade-off that you get is that you have to go to the doctors that they want to send you to, and they may restrict, in other words, the doctors that you can see. But these are huge insurance companies, and they've gotten bigger and bigger and bigger. And now, like I said, over 33 million Americans on Medicare are enrolled in them, and that's given them a lot of political clout to get what they want. And what they want is, and they're mostly for-profit companies, and they want to continue to make good profits. So what this article was about was the Centers for Medicare and Medicaid Services in Washington D.C., which runs the entire Medicare and Medicaid programs, and they had become concerned that some of these health plans were, doing things that were raising profits that were improper, like they were finding things wrong with you that weren't actually wrong with you.
Mhm, mhm.
They go and look in a chart and they'd say, well, you got diabetes, and they put down that, well, it's got complications when it didn't have complications. See, under the pay
Uh,
system that they do for these plans, they pay you more if it has complications. So what the government was seeing is that these coding that they use to pay these plans, it's developed into a formula they call a risk score. They kept going up and up and up, and it's costing the government more money. So in
mhm.
2014, they said, well, but they're doing a lot of these chart reviews, they call them, where they're going back in and mining all this data and finding all these things that are wrong with you that may or may not actually be wrong with you. And it's costing the taxpayers a lot of money. And what they were doing was, when they would go through and conduct these audits, they only look for things that would cost them more money. I mean, cost the government more money and make more money for them. And they ignored things where they'd overbilled to begin with. So in other words, they call it looking two ways in a chart review. So when you do this chart review, you're supposed to do the chart review so that you find the correct amount, not the amount that's in your favor, and ignore it when you got overpaid, right? And the government expects you to find out when you got overpaid and give the money back. And if you got underpaid, they'll pay you more. So
Yeah.
they decided to have this regulation, and they decided, well, what we're going to do is we're going to make a regulation here. We're going to put it out in the Federal Register, and it's going to say that if you're going to conduct these kinds of reviews looking for more money, you got to also look for the times when you got overpaid and we want our money back. And like, oof, man,
Wow.
things blew up. So the industry did not like this at all, because apparently a lot of them were doing these quote one-way reviews where all they were doing was getting more money and not giving any back. So, after the big blow up, they backed off, so this was January 2014 when they proposed it, and then in May of 2014 they'd had enough of the criticism and they just said, okay, we're not gonna do this. Well, the reason that we wrote the article about that is that this was a matter of billions of dollars of taxpayers' money that and now it's coming and getting new attention because there's a huge Justice Department lawsuit against one of the biggest insurer, I think, in the world, United Healthcare Group, for doing these kinds of reviews like this that got them more money and then not giving back the money that they were overpaid. And so, if a lot of other companies are doing this, you're talking about billions and billions of dollars. In the United Healthcare lawsuit, the Justice Department is alleging that they made $7 billion by doing these data mining reviews, and that 2.1 billion of that they shouldn't have gotten. They should have given back. In other words, they took it from the government and they shouldn't have taken it. So just that one company, for a few year period here, you're talking $2 billion. So the reason we wrote about that is that, well, who's running the show here? Is the industry running things, or are the government regulators running things? And it has to be a partnership. Both sides have issues, and they both have opinions and stuff. But ultimately, somebody's got to say, we're not going to allow this. Yeah.
Yeah, yeah, yeah. So one of the things that is a kind of a pressure out there now, and maybe you can clarify this for the audience. There's a difference between an insurance company and a health company that is providing care. And sometimes people get those two confused about, is this, an example, Aetna or Blue Cross Blue Shield versus a Humana versus a healthcare, these kinds of companies. And one of the things that we've been having seen as a veteran, at least I've seen, is a little bit of a pressure from those companies you're talking about to become a supplement to TRICARE. And so TRICARE, you already have that coverage, and they are saying, well, this is a better plan. And there's been a push to try to privatize, the VA system and to move it into that kind of arena. And then I'll talk to you about one other, another factor that's coming into play that may be, significant. So do you, maybe you can talk about the difference between the insurance companies, and those who are providing the care.
Well, many of these, like you said, they're big insurance companies, and then they contract out the care to doctors. So they sign contracts with local doctors groups, so that they don't actually provide the care, but
Right.
they handle all the billing, and the doctors are supposed to, like, they treat you, and then they send in um, a report to the health plan, and then the health plan goes to Medicare and says that bills for these services. And where some of the alleged hanky panky is going on is not with the doctor, but when it gets to the health plan, then the health plan decides, well, that doctor, he didn't write down this, he wrote it down wrong, or he didn't put in this thing and he should have. We're just going to stick it in there and send it into Medicare and get billed for it.
So it's like upcoding. They're
Yeah,
putting those.
upcoding. Essentially, yeah,
Right.
commonly upcoding, or in some cases
Yeah.
finding non-existent things, and so when you do that, then you're vulnerable to the government's vulnerable to getting ripped off. I mean, the taxpayer,
Yes.
getting ripped off, and you read stories all the time about Medicare's going broke, or we don't need to get ripped off. I mean, we need to provide care to people at a proper price, and we're not against anybody making a profit at
Right.
all, or we're just saying that that the program has to be run in a sensible way in which taxpayers' dollars are protected, and you just can't let some company run off with money they don't deserve.
Right. Yeah. If I go to a pizza parlor and they give me, say, well, it's $19, but if they came back and said it was 1900, I think I'd have a, a different view about what a pizza is.
Yeah.
uh, But yeah, so that's really interesting. So what do you think the implications are? So I mean, this actually impacts me as a taxpayer because that means that the taxes may have to increase to meet that kind of demand that's really not a true demand, that it's a false demand that's being imposed on the system.
Right. Well, I think that, critics talk. You mentioned about attempting to privatize the VA, which has of course been a huge political issue for years. But I think maybe some critics think that privatizing the system like this and getting these private companies in brings in a rush to make profits and will drain the taxpayers' coffers. Now, but I mean, I think personally, I would say it doesn't have to be that way, but that's
Mhm.
again why we wrote that story, because we're
Mhm.
wondering if who's minded the store, if
Right.
get pushed around by. I mean, I understand they're big companies and they don't like it, but you don't. I mean, you got to follow the rules, right?
That's right, right. And one of the other things that's a complicating factor, as I was mentioning earlier, I was going to ask you this particular point. But I used to run the Illinois Department of Public Health back from 2007 to 11,
Mhm.
and one of the things that I've been seeing in the public health arena, so the American Public Health Association, American Association of Public Health Physicians, I'm a past president of that. One of the things that we've been looking at is the diminution of people who are actively engaged in the workforce. Both doctors and nurses, and there is a feeling that about 20 to 30% of doctors in the next 3 to 5 years will be retiring. About 30 to 40% of nurses. That's going to put a big strain on the system. So you actually have paraprofessionals being trained to do things that traditionally doctors or nurses would do, and I'm not so sure that's a great idea. You have minute clinics flying up, springing up everywhere, and I'm not sure if that's more of a problem for control of a system that's already seen sounds to be a little bit broken, from what you're describing.
Yeah, well, a lot of that stuff comes under the banner of what they call a scope of practice. And
Yes.
if you're an insurance company, you want to hire the people that you can pay the least amount to,
Hmm.
and let them do more complicated things. And so, but if they're trained properly to do it, so if you have a nurse practitioner or a physician's assistant, and it's less expensive than having an MD or a DO,
Hmm.
and they're properly supervised, and they're handling relatively minor things, it's fine. I mean,
Hmm.
that's a sensible system.
Yeah.
And it's all about balance and just not letting things run amok, and
Yeah. Yeah.
not letting people that aren't properly trained. I mean, who wants to go to it? Whether it's a doctor or a physician's assistant, you want to make sure that person knows what they're doing, right?
Sure. Sure. Especially if they pull out the scalpel, you want to make sure they're making the right cuts.
You got that right. Yeah.
Yeah. So, what do you think a resolution to this problem would be? Because it sounds like it's still festering in the background, even though you were saying in 2014 they, sort of backed off a bit. But it sounds like it's still, we still are facing an economic challenge. That there are still things going on in the background because you hear these reports coming out once in a while that we have a bigger deficit in
Right.
healthcare spending and that kind of thing.
Well, it's a pretty complicated problem because, like a lot
Hmm.
of the overbilling, let's say, or overcharging or alleged overcharging, it's not apparent to the patient.
Hmm.
Because you don't know anything about this. This is all going on behind the curtain. You're
Right.
going to the doctor, you're getting treated, you may be happy, and you probably are reasonably happy with the treatment you're getting. You don't know what they're sending to Washington to get paid. So you don't see that. So you don't necessarily um, know that this kind of thing is going on. And so that makes it pretty complicated because it's not coming out of your wallet. If it's coming directly out of your wallet and you see it, then you really you're going to start screaming about it. But when it's more behind the curtain like this, then it's the taxpayers overall who are footing the bill for this, and the people on Medicare are not necessarily feeling it. And you know. They vote,
Right. Right.
and they have a right to petition their representatives, and they do, and they go and they say, well, we don't want this program cut, and but some of these other people are saying, well, they're getting paid too much. We need to cut back. And then the healthcare companies say, oh, no, no, you know, if we're going to drop out. In fact, just today, there's a story that one of the big companies was dropping several 100,000 members because I guess they don't think they're making enough money. So you see, there's a lot of political pressure to bear. And then if the Medicare office in Washington says, you know what, we're going to have to cut that, then they get 200 or 300 members of Congress, writing an angry letter saying, "Don't you dare do this," and people with signs and whatever. So it becomes a really complex problem. And originally it was kind of a Republican idea,
Mhm.
to
Yeah.
privatize this. Let's get let's let the business community knows better than government, so let's let them run it. But it's shifted over the years, and now a lot of lower income people like this, and their representatives and their senators are responding to that and defending Medicare Advantage, even though there are all these groups out there that do audits and things that are saying, wow, they're charging too much, and we need to cut them back.
Well, okay, Fred, I'm going to admit that I have my AARP card with
Yeah,
all the political action.
here too.
But I was thinking also, with this, all the people need to be a little bit more engaged in this and making sure that they are keeping an eye on it. Right now we're also talking about federal spending for pharmaceuticals, and we have now a cap on insulin. And a cap on, I think 10 other drugs are coming down the pike, to be capped. But the pharmaceutical industry also is an industry that seems to be, charging quite a bit for some of the medications that we have. And what scares me is when people go overseas and they get, something that comes from China that says, take this cowhead pill, and this will take care of the cure your diabetes. I just because I'm a physician myself, so I'm worried about the implications of people sort of cutting into the market. Um, but this actually seems like a progressive idea, more of a positive idea with saving the government, being able to negotiate prices through Medicare, which we haven't been, really doing that in the past. But what are your thoughts on that, on the pharmaceutical and
Well, I think that yeah, they charge too much. I mean,
yeah, yeah,
you look at these prices and it's like, are you kidding me? And then it was really galling if you find out you could buy it in France for half that much,
yes,
and it's the same drug. And then that's a whole kind of another issue if you have like it came from a factory where you don't know whether that factory is up to snuff or whether they're being inspected or not. But when you're talking about like going over to Canada across the border, you would drive across the border and it's a fraction of what it is, then the public has a right to say what's going on here. Why are we getting ripped off?
hmm yeah. And then we also have those, the issue. I'm seeing this all the time now. It's the off-label use of medications. Some of them have black box warnings. Don't use it for this, but many of them don't. And we have things like Ozempic, for example. For weight loss, and there are things that are sort of off-brand label usage. And I'm not sure if that's having, a deeper impact on the federal government as well through a Medicare, programs.
Yeah, well, I mean, you're not supposed to. The drug companies are not supposed to advertise a product
Mhm.
unless it's approved by the FDA for that use.
Yes.
But that doesn't mean they can't sell it. That's exactly right. What's happening with Ozempic and these other drugs. But sometimes you have a drug, and you take it for one thing, and then you see all of a sudden you start seeing, wow, look, it works miracles. Like, and I think that kind of
Right.
happened with Ozempic. You're taking it for diabetes, and you're also noticing, wow, I lost a lot of weight. And the next thing you know, that someone wants to sell it. But I think that I'm not like I said, I'm not anti-business or something, but the prices
Right.
of these
Right.
drugs really are outrageous. And you look at the people that it might do the most good. If they don't have the dough, then you're out of luck. And you could argue that it really shouldn't be that way.
Yeah, and it's kind of a balancing act too, because if you don't, for example, if you have someone that is exposed to COVID-19 and start developing symptoms, you do have, the Paxlovid and that kind of thing that people are taking now and prescribing. and then you also have the issue of being vaccinated, against it, and it actually is a cost savings in the long run. So I think that's why if you go to a pharmacy, we have now had the flu shot out. We have the COVID-19 updated version of it. There are three variants that weren't covered by the prior vaccine.
Mhm.
Some I think that's a cost savings too to the government because that stops hospitalizations, unnecessary hospitalizations, ICU admissions, ER visits, those kinds of things. So, what do you think about those kinds of cost savings measures? Should we be looking at those more?
Well, I think yeah, it's complex. Yeah, if you may be paying money up front to save it down the road,
Yeah,
but it's
mhm,
always a tough thing to figure that out. Whether it's a car,
yeah,
buy
yeah,
a car that you got a good price on it, but it breaks down all the time, and so then you got to have all this money in repairs. And so the bottom line, maybe down the road, you would have done better to buy a car that doesn't break down. And it's kind of the same thing. It's very difficult to assess that.
yes,
But you're right. I mean, obviously, if you are take a thing like a drug like Ozempic, if you're getting rid of massive problems with obesity related diseases, and maybe it's cheap. That it's 20,000 a year or whatever it is. So yeah, it's really hard to make a decision like that. And I don't think there really is anybody that thinks, and not that it doesn't think like that, but there isn't anybody that really is effectively looking at that kind of thing. I mean, there was a thing that under the Affordable Care Act, there was a thing, PCORI, that was supposed to do comparative effectiveness research. And it was supposed to look at the effectiveness of various treatments and like, what if you do this, what happens, and then be able to tell the entire medical industry, you know what, this is the way you should treat something, and this is the cost-effective way to treat it. But that got all wrapped up in politics, and then before you know it, somebody's yelling about death panels and things and things like that. And so it gets all wrapped. But it's just common sense that that if you're a doctor, you want to know
yes,
what is cost effective, and your patients can afford. And the bottom
and
line
safe.
is,
Mhm.
people come in sick, you get them better. That's what you want, and you don't want to be fooling around with something that doesn't work. But you don't really know if it doesn't work unless someone does this kind of research. But no one does this kind of research because it's a death panel. So
Yeah.
it is kind of it's a
Mhm.
very complex thing, no question.
So as a person who's a citizen, how can I get more involved in making sure that the system is protected? There's a lot of fraud going on there also outside with people, dipping into people's things through AI and all those kinds of things. But if I get a bill and it doesn't seem right, because somehow even if they put those things in for the billing cycle, there has to be a record somewhere that
Right.
goes back to your records or your chart or
Right. Well,
so
you got to start by reading the bill, and then if you don't like it, it doesn't seem right to you, pick up the phone, and call somebody and complain. And if you think that there's a fraud or something, call the authorities. And yeah, you have to really bird dog these things. I mean, no one's going to do it for you. You have to pay attention, and and it's the same with any kind of consumer bill. If the bill isn't right, then. But I think with healthcare, it's so complicated. When you look at it, you don't. First of all, you don't even understand half of the terms. What does
terms.
this mean? And it's all these codes and all these numbers and things. And the thing is, it ain't that complicated, really. Like the
Right.
numbers. So, but you don't know what they are. So how are you supposed to know what's going on here? But you have to be willing to make an issue out of it and complain about it. If you don't like the price, call up and complain. I mean, years ago, you, no doctor seemed to ever know how much something cost.
Right.
If you said to the doctor, "Well, how much is that going to cost me?" And I don't know. And I think it's gotten better like that. But I think as consumers, that's how you have to think about your healthcare. It's just like you said, buying a pizza. It's no different, really, in a lot of ways. It's a commodity. You're buying it, you're paying for it, and you want to pay an honest and a fair
Mhm.
price for it, and you don't want to get ripped off.
Yeah, Fred, this is a excellent conversation. I think we go on for days with this particular topic because as a physician, I remember, when I was going through training and residency and all that, they had codes. And I was looking at the codes and it's like, wait a minute, once it goes to the next level for billing, it's a different code. So they were translating the codes into another billing system. And
Mhm.
I said, how do I know what you're putting down is correct?
Yeah.
And it actually matches that. So there are systems like that within healthcare establishments where the provider, the nurse, the doctor, the PA, the nurse practitioner, they don't know what that actually represents for their patient. And when they send them out, especially if you have a patient who's on Medicare or dual eligible Medicare, Medicaid,
Mhm.
you don't know what they're going to be charged down the road. But I have 1 minute. I want you to do a wrap up, and I want to bring you back on because this is phenomenal what you're doing. I am. I think society owes you a debt for this.
Well, thank you.
For uncovering this, and this story is phenomenal. I've read it, so. But go ahead, Fred. Say something that you think is really pertinent that people need to know.
Well, I think, people need to know, like I was saying, that, healthcare is a commodity like anything else. And don't be put off or scared by the fact that the person's wearing a white coat and has a stethoscope and and talking down to you. And
Mhm.
don't be talked down to. Don't let them do that. They have to know that you're the patient and you've got rights and but you also have responsibilities. And your responsibility, I think, is to make sure that, first of all, you get better if you're sick, but
Mhm.
also not to allow the system to be drained by crooks and overbillers, and to know that, if it doesn't look right, then just,
Don't
say
do it.
something. Yeah, say something about it, and complain, and because the
Yeah.
thing, if you don't say anything about it, then nothing's ever going to change.
It's that old saying, if you see something, say something. So,
Yeah, yeah, yes, or write it, or put it in writing, or whatever. But
mhm.
I mean, I think that's what we do a lot of stuff with whistleblowers, and
Okay.
there's a strange thing to do this. It can be a very difficult thing to blow the whistle.